Okay, good evening, everybody. Tonight's agenda, I hope is going to go along smoothly. I'd like to call the meeting to order. And I'd like a motion to approve the minutes from September 24th, 2025.
I make that motion to approve the minutes from September 2025.
Thank you. Do we have a
Mr.
second?
Chair, if we can just hold that, I have to go through my spiel about
Oh,
virtual meeting stuff.
Okay, sorry. Thank you. Thank
No,
you.
it's okay. And I know Zach's on here as well. Zach, if at some point can just make Noel co-host and any other lagging board member. So good evening, everyone. This is the Tri-Town Health District Board of Health meeting, November 19th, 2025. Pursuant to Mass General Law, Chapter 38, Section 20, we are hereby informing everyone that this meeting is being audio and video recorded, and the public and all participants are hereby notified. A copy of this recording will be made available on public access television. Now, Mr. Chair, you can go back to what you're doing.
Okay.
Can I second that
thank you.
motion?
Okay, so I've made a motion to approve the September 24th, 2025 minutes. And Diane, was it you that that did that? Thank you. And do we have pardon me, that moved to approve the minutes? May I have a second?
I second that motion.
Thank you, Joanne. And then can we have a vote to
Yes,
approve?
roll call, please. I'll call off. This is fully virtual. Every vote has to be roll call vote. So we'll say Joanne,
Yes.
Diane,
yes.
Carissa,
Yes.
Charlie,
Yes.
John,
Yes.
and Noel's on. If he can unmute himself or give me a thumbs up. And I think John Kearns is sort of working his way in. He's still sort of joining. Well, the motion passes. So Noah, you should be able to unmute yourself, but I'll double check real quick to make sure that you're a co-host.
Okay, so the next item of business is a discussion of the fiscal year 27 draft budget by Jim.
Yes, give me 1 second, and I'm going to do a screen share. I'm a little rusty on my virtual skills. Been a while. All right, can everyone see this?
Yes.
Yes.
Okay, great. So stop me whenever, ask questions. I'll try to kind of go through the highlights here. This is the annual requirement where we present a draft Tri-Town District budget for Board of Health approval, then gets kicked off to each towns. And then if the Finance Committee wants us to present, I'll usually handle that. And then I'll usually invite a board member for each town to go. That's just sort of quickly the highlights: proposal, revenue, accomplishments, collaborative stuff, priorities beyond. Quickly, this budget incorporates annual cost of living. We have people that qualify for longevity stipends, and we, similar to what the town of Lee does, we set annual goals for each staff. And if they accomplish those goals, they get an additional percent increase in pay as part of that. We don't incorporate step increases. This is something that we've had put in place for a while. When I get to the numbers, and you'll see the fringe benefits is down quite a bit. I initially thought there was major miscalculations and mistakes, but I think somewhere along the line last year, the retirement assessment formulas were a little bit out of whack. And so we actually budgeted more in FY26 than we should have. So any leftover money at the end of the fiscal year will be returned back to the towns. You'll see in a second that we are eliminating the comp reserve line item in the budget. That was a line item that was created a few years ago, but I'll explain that when I show you the numbers. Again, we typically don't know the final health insurance numbers. Usually we won't get that to like February, maybe March from the town of Lee, we will expect some level of an increase with health insurance. The last couple of years have not been good when it comes to health insurance costs across the board, not just for municipalities, but for many private and other public organizations. We're still on the similar 3-year rolling average where we look at the services provided for the communities. We're gonna do another deep dive in FY27 for a couple reasons. We're seeing some growth in potential big projects coming down the pike. We don't know where the Sisto is. The Elm Court's looking at a big project, the Eagle Mill's happening. And we're seeing more and more requests for inspections, housing complaints. And so we had been struggling the last couple of years of having our 2 full-time inspectors full-time. Ellie took over a while back for our second inspector, and we're starting to settle in, and we want to have a good, basis of doing another deep dive to see if the percentages will change. It's hard to do that when you're short-staffed and you're somewhat behind. It doesn't show a true reflection. So I've already communicated with 3 towns. We're gonna double check all those numbers, and if adjustments need to be made, we'll make them. We did increase the permit fees by 20%, if I'm not mistaken, Zach, but that was for January 2025. And so we are down slightly in revenue in Lee, in Stockbridge, up a little bit in Lenox. I believe it's to do with a reduction in some of the septic work we're doing. Some of the Title V's were down. And then when Tri-Town had to move from the Aroldi building, we actually had to shut down the lab for a while because that's a big process to decommission the lab, wait, move, set up. And then we also struggled, it's not on here, but we struggled with some products, being on back order for quite some time. I feel really good about as we go into the new renewal cycle, which is happening right now, because our permits are on a calendar annual basis and they expire December 31st. So all the renewals coming in now are going to be subject to those new fees. Usually when we do a fee increase, our renewal process usually starts in like October, but when we approved the 20% increase, it was effective January 1st. So I feel like a large chunk of those renewals came in before January, so they weren't assessed those fees. So I think as we reconcile the next fiscal year and fiscal 26, I do feel pretty confident that we'll settle in on our fees. All right, so this is the budget. Very busy, but if you look, if you can see my pointer, up where it says full-time, we used to level fund that. And then if you look way down here where it says 5795 comp reserve, that's where we would put anticipated pay raises. The towns asked for this several years ago just to see where the pay raises were coming from. What's it look like for cost of living? What's it look like for longevity? And then what we would do is once the new fiscal year would start, we would then move that amount up to the full-time salary line item. But a comp reserve for Tri-Town doesn't really necessarily work like a comp reserve line item because we work on annual appropriations. Tri-Town is not set up with a special revenue account where we add money and the money stays there over fiscal year per fiscal year per fiscal year, versus like a comp reserve line item each town has on their own. If someone retires early, they can pull someone in at the same time. And that is a line item that builds up over time. Tri-Town is not set up that way. And every time we went to the finance committees, they were really confused on the comp reserve line item. So to make things completely clear and concise, we're just going to eliminate the comp reserve line item and budget up here with our pay raises there. Now, one point of fact I want the board to understand is we're not getting a $31,000 increase for FY27. You have to take consideration the 14,000 that was moved up. So that in reality, the anticipated pay raises is around $14,000. I've already explained that to the town managers, because that if you take the 31,000 away from the 14,854, that's what our pay raise increase is. So you'll see in yellow here, we went from $192,000 in fringe to anticipated 147, $45,000 difference. And that incorporates pay raises, by the way, with our retirement assessment. So there was a miscalculation, and that's why the bottom number is almost a 5% decrease in the budget, although we're asking for pay raises and in level funding our non-staffing line items. So we shouldn't have an issue. Oops, sorry. Let me go back. We shouldn't have an issue going to finance. So as far as the non-personnel line items, the only difference is our travel. I cut that down because we used to budget 7,000, but we really never got past 5,000 in actual expenditures. So there's no reason to keep that $2,000. And so I reduced that down, and 5,000 is plenty of resources needed to get the work done. And so bottom line, it's about a 5% decrease, mainly due to the fringe benefit adjustment. I anticipate that number changing because, as if you recall, the health insurance will probably go up, but I still think the bottom number will be somewhat manageable when it comes to, meeting what the towns are asking all departments to do. Any questions? Okay. All right, this right here is just the 3-town breakdown. Shows what, it's basically all the line items, and down here, this is what Lee's request is, Lennox request, Stockbridge. The less in kind is what Lee gets credit for bookkeeping, since they're our fiscal host, and now Stockbridge is providing rent, so they get a credit of the 2357, which changes the bottom percentage just a little bit. The only difference is really because of the in kind. So it's a reasonable budget, probably the easiest budget I've probably put together in quite some time. Any questions? All right, moving on. Uh-oh, what's going on with my computer now? All right, hold on.
So are we ready for the next agenda?
I'm having some technical difficulties with my presentation. Why? There we go. So this is just the revenue. You'll see here the top line, Lennox went up a little bit. Lee and Stockbridge dipped a little bit. We didn't really lose a lot of revenue, but the chart, because we only make so much revenue, shows a significant decrease, but it's really not. We FY24 we pulled in 174, so it's a $5,000 difference, give or take. It's not a significant amount. Most of that I would probably anticipate was the lab and some reductions in Title V's, which I do feel this year our septic and perk test is really up. I think things are starting to rebound a little bit. Okay, that's just our turnover schedule that shows what we pull in for fees and whatnot. All right, and really that's just the budget. So if you give me a little bit of time, I'm going to go through some of the highlights that I think are really important to really reflect the hard work and dedication that all the staff is doing. I can't accomplish what I'm accomplishing without the top-notch staff that we have across the board. I just can't. I can't say enough. Not only do we have board support, community support, we're doing a really fantastic job, and I'm really proud of the accomplishments that everyone's doing. So our PHE shared collaborative grant is now in year 4. Lee and Tri-Town's the fiscal host for that. We covered 12 towns through the grant. We're on year 3 as the vaccine provider. Dr. Kenny's our medical director for that. He helped support us with all the standing orders and everything that's required for us to purchase vaccines. This is only fiscal 26, so we're in fiscal 26. So these are FY25 numbers. We're killing it in FY26. I won't have those numbers for a while. They're going to be even higher than these numbers. So FY25 for, almost 1,500 flu shots, about 1,300 COVID. I have reason to believe we're pushing 2,000 now for COVID. We'll really see once the flu season's over with. We've really doubled our homebound vaccine program, working through the councils on aging, helping with that. Our monthly blood pressure clinics in our collaborative are increasing. We're seeing significant increases in participation there. And we also became a certified pediatric vaccine provider, which is fantastic. Part of PHE is not just nursing, but we also have a full-time shared health agent that's supporting certain towns in South County to professionalize them. This is just a summary of some of the inner reports, between the nursing collaborative, the measles outreach. We put together this massive resource guide that's hard copy and digital, and we're doing a lot of work with TIC education. Tri-Town accomplishments, I feel like we're stabilizing our revenues. Our household hazardous waste collection is getting stronger than ever. We had to increase that budget this year. We're pulling in a lot of gallons of waste that would normally not be in, it's going to the right places, not in someone's garbage can or out in the backyard. SAFE 2.0 is new state legislation that requires all public health people to be certified and licensed. Tri-Town has always been ahead on that curve, but it's state law now, and there's other trainings that staff will need to do. Our tobacco program, we got an increase in our tobacco program. The PHE funding for the grant is stable for the next couple of years, but we don't know what the future holds. And one of the biggest things that we got to start to think about with respect to the collaborative, if this grant funding goes away, what does our nurse program look like and all these other programs? Because if the board recalls, when we went into the pandemic, we actually never had a nurse program. We didn't have a budgeted nurse. And then luckily through the grant, Tri-Town benefits on that. And so we're always having conversations through the SBPHC governing board. We're trying to pull in a little bit more money for the nurse contracts to help offset the cost, but we don't know what the future holds with the instability with the government right now. If something were to go south, I feel like Tri-Town and the leadership that we have across the board would be in a good position to have those conversations to keep this program up. All right, almost done. Sharps kiosk programs, they're in most towns now. We moved. That was a lot of work. The ACO, Animal Control Officer, is not part of this budget, but we are working with the 3 town managers, and Mike Canales being a good lead on that. We're working on a proposal for a 7 to 8 town shared animal control officer position that would be full-time with 24-hour access and support for animal control. So keep your eyes and ears peeled on how that process goes. And again, Tri-Town, oldest health district in the state. We're almost at 100 years, and I think we do a pretty good job of what we're doing.
Jim, can I ask you a question about the animal control officer?
Sure. Yep.
Do they handle bears?
Actually, animal control officers only domestic animals, cats and dogs.
Okay, thank you.
Yep. And again, I already highlighted all this. I don't need to go through it all again, but the slides can be available if the media's here. They'll be posted on our website, and yeah. that is the end of the presentation. And I'm open to questions, comments, answers, but hoping to get a motion to approve it.
Well, I'll make a motion to approve the budget.
I second that motion.
No discussion?
Does
Oh.
anyone, okay, can we have a roll call vote on that, please?
All right, Joanne,
Yes.
Diane,
I'm gonna say yes.
Carissa,
Yes.
Charlie,
Yes.
John L,
Yes.
John K,
Yes.
Elias.
Yes.
Noel. Not on mute, but I'm sure he's okay, but you can unmute, you should be able to unmute yourself, Noel. Okay. All right. All right, so that's the budget. All
Okay,
right.
thank you, Jim. So we'll look now at the department updates. Once again, that's Jim, unless you feel that you already did that as part of what you were talking about.
Yeah, so this following up from our last Tri-Town Board of Health meeting, we had some guests talk about the nicotine-free generation, and we kind of went over our draft tobacco regulations. And I think there was consensus that we still wanted to learn a little bit more about what nicotine-free generation is and some of these other policy changes. And so since this budget meeting is usually mid-December, it's early this year because the towns wanted to get the budget out. I'm going to be working over the winter. We may not be ready by the next Tri-Town meeting, which will probably be sometime in January if we have pending issues. But I'm working on a subject matter expert panel webinar training program where I'm going to pull in a series of experts on this subject with the intent to do a presentation and have it recorded like as a webinar. And we'll put flyers together. We'll invite the boards of health, but it'll be informational only. So, we won't have to post a meeting, and this board and everyone here will be able to come to it. If you want to pose questions, you can get them to me ahead of time and get them answered. And it's really meant to provide some type of informational session, not only for the Tri-Town boards, but our tobacco program works with many other municipalities in Berkshire County that are interested in this subject. So that's going to be something I'm working on post-holiday season. That may or may not happen by the next Tri-Town meeting, but I want to try to ask the board to keep the tobacco regulation on our tabled items. So how our agenda works, we have active agenda, then we have tabled items that would kind of keep things in the parking lot, but we don't discuss them unless they're moved up to the active agenda. So for that reason, I would like to ask for a motion in a second and a roll call vote to add the tobacco regulation process to the tabled items below for future
Okay,
discussion.
can we have a motion to do what Jim is suggesting? That is to add the tobacco regulations process to our list of tabled items.
I'll make the motion.
Thank you, John. Can we have a second?
I'll
that.
second.
Okay, thank you. And
Joanne?
was that Joanne that did that?
No, now we're voting.
Diane.
Doesn't matter.
I couldn't see.
Yeah, Joanne, Diane,
Yes.
Carissa,
Yes.
Charlie,
Yes.
John,
Which
Yeah.
John?
L,
Where'd John go?
Elias,
Yes.
John K says
John
yes too.
K. and I know Noel's there, so I'm just having I know he had to call in from his phone. All right, so that's that. Yeah, that's all I have. And tabled items is the next item on the agenda.
Okay, so the tabled items can be discussed if somebody wants to request that the board by making a motion to have it brought forward so it's a part of tonight's discussion, and then seconded, we'd ask for a roll call vote, and a majority of people on the board want to move it up, that item up to a current discussion item, that is tonight. We can do that. So the current tabled items are the tobacco regulations process, the UDF transportation plan, the green burials, and cyanobacteria updates. Pardon me, I think the other two are they tabled items, Jim, still?
So we have UDF, green burials, and cyanobacteria updates, and then obviously we voted on
Those
tobacco
are all,
tonight.
those are all tabled items.
Those are all
So
tabled
does anybody
items.
want to bring one of those items forward tonight by making a motion that happened? Okay, fine. So then I don't have any other items on the agenda to be discussed unless I'm missing something. So I'm going to ask for a motion to close the meeting.
Oh, citizen speak.
Oh, sorry, pardon me. The citizen speaks time. Jim, do you want to give the rules for that? I think tonight, I don't think we have too many people here as far as I can see.
Yeah, so we have Denny Alsup and we have, I'm assuming Leslie. If either of you are interested in saying something or offering any ideas, just raise your hand, and if you go to your React table at the bottom, you click on, you can raise your hand. We'll give it a couple minutes if you want to ask any questions during citizen speak, or if you're just listening in. I'm going to ask Denny to unmute because he is a participant in the meeting. I wasn't sure, Denny, if you wanted to offer anything to the board.
No, just full of appreciation for what you guys do. Thank you.
All right, going once. Going twice. All right, sold.
Okay, thank you, Jim. So that being the case, I'm going to ask for a motion to adjourn the meeting.
I'll make a motion to adjourn the meeting.
Thank you, Diane. A
I
second.
second the motion.
Thank you,
I second the
John.
motion.
All
Can we
right,
have a vote on that?
Joanne,
Yes.
Diane,
Yes.
Carissa,
Yes.
Charlie,
Yes.
John L,
Yes.
Elias,
Yes.
John Kearns.
Yes.
All right,
Good night, everybody.
thank
Good
you.
night.
Thank you.
Thank you.
Have a
Bye-bye.
good Thanksgiving, everybody.
You too.